The growing concern over what doctors are seeing in hospitals across this country, the triple threat tonight of COVID, flu, and that virus RSV all hitting at once. Take a look at the map tonight. 14 states and Washington, D.C. all in red there, really across the country, north, south, right through the middle of the country. These are all states with hospitals with pediatric beds at more than 80% capacity already. Tonight here, Dr. Jha on what parents should know. Steve Osinsami from Atlanta now.
What they're seeing at children's hospitals across Atlanta tonight, they're seeing in places across the country, about 3 times more sick children than usual. In one location, they had to put up a tent back in August to help process all the extra children. This time, it's not just COVID, it's the flu and a seasonal virus that's especially dangerous for young children called RSV. This evening, 5-month-old Bentley Phillips is hospitalized with RSV in Green Bay, Wisconsin.
It started with the wheezing. He progressed so fast. His oxygen was so low that we don't know what would have happened if we were home any longer than we were.
It's early in the winter cold season, and children sick with respiratory illnesses are filling up pediatric beds across the country. In 14 states and in Washington, D.C., they're already more than 80% full. In severe cases, the children can't breathe.
Really small babies have a harder time in clearing their own congestion. They can't sneeze. They can't cough as hard. They don't have the chest muscles to really expel all that. This is why young kids are at increased risk when it comes to RSV influenza of getting hospitalized.
Our Mary Bruce at the White House today was pressing officials.
How concerned are you that this limited capacity will be stretched even more? And what can you say to parents who are concerned that they may have trouble finding care if their child has RSV or the flu or COVID?
First thing, what I would recommend to parents, which is what I've done as a parent, is gotten my kids vaccinated, right? Because if you can get them vaccinated against flu and COVID, that takes 2 of the 3 issues off the table. It also creates more capacity in the healthcare system, and it just makes it better for everybody.
Authorities are warning about a possible triple-demic of COVID, the flu, and RSV.
We're really tracking healthcare capacity very, very closely across pediatric hospitals. And obviously, if hospitals need help, we will step in and help them to make sure that all kids across America get the care they need.
At Children's Healthcare of Atlanta, they're telling parents it's still not too late to get their kids vaccinated. And they want parents to know that 95% of children hospitalized here tonight were not vaccinated for the flu and or had incomplete vaccines for COVID.
What you're seeing is that most of the kids who are coming in are unvaccinated for COVID and flu.
Those that are requiring hospitalization or have severe infections, yes.
There is no available vaccine for RSV, but there is for COVID and the flu. Doctors at this hospital behind me say that 75% of the children hospitalized here this evening with respiratory illnesses are sick with the flu, and almost all of them weren't vaccinated. David?
All right, Steve Osinsami tonight. Steve, thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.